Excuse me, Mr. Gio.
Yeah, what's up?
What does it take to become a champion?
You gotta dream, you gotta think, you gotta act, you gotta ball, you gotta bleed, and most important, you gotta believe.
You gotta dream
like a champion,
think
like a champion,
act
like a champion, say I'm a champion.
soar
Like a champion,
Bleed.
like a champion,
Look in the mirror and believe.
you're a champion.
You gotta dream
Like a champion,
think
like a champion. You're tuned in to IChampionHealth Chats, the podcast for amplifying community voices and advancing health for all in Lexington, Kentucky. Each episode connects you with local champions who bring powerful stories, useful tools, and fresh ways we can show up for ourselves and others. Let's lock in and learn how we can champion health together. All right. Well, good afternoon, all my listeners and viewers, and welcome to another episode of IChampionHealth Chats. I am your host, Gerald Gio Gibson, and joining me today is my co-host, Mr. Jacob Hester.
I'm Jacob Hester. I'm Program Coordinator for IChampionHealth, a community engaged initiative in the UK College of Education.
All right. And I also do Operation Making a Change. I am the founder and executive director. We focus on violence prevention and intervention. But joining us today, we have a special guest today. We have Commissioner Kacy Allen-Bryant. And Commissioner is going to spend some time with us today. And, you know, it's always good to see you. We've been knowing each other now for the last 4 years. And I just want you to know how proud we are of you, watching your career, your journey in life flourish and just, you know, be blessed in so many ways. So welcome, Ms. Commissioner Kacy Allen-Bryant.
Thank you. I'm so glad to be here with you all today.
Yes. So for our listeners and viewers, could you share a little bit about your journey, about yourself and whatnot?
Absolutely. So one of the things that I sometimes forget, but it's very important to my journey, is the fact that I'm a registered nurse.
Okay.
I went to the University of Kentucky. Been a registered nurse now for 25 years, so a quarter of the century. My specialty is public health, and so for those of you who don't know exactly what that is that we work on populations and preventing disease and promoting health among various populations. And so that's really my background, and I've worked in all kinds of settings, from home health to occupational health to the jail. It's because we really, again, public health nurses work on focusing on populations, but within everything that I've done, I was faculty at the UK College of Nursing for 17 years. Enjoyed it a lot, passing on my knowledge to nursing students, not just about public health nursing, but also about professionalism, cultural competency, cultural humility. One of the great things about working at UK, as Jacob knows, is that they really push you also working out in the community. And that's where I got a lot of my community experience and working with partners in Lexington-Fayette County, including many of the partners that I now supervise in social services. One of the activities that I was able to do while I was at the College of Nursing was work on the Board of Health, Lexington-Fayette County Board of Health. And for 3 years, from 2017 to 2020, I was the board chair. And in that time, I got to interact more closely with our current mayor, Mayor Linda Gordon. And when this position came open, she came a-calling. And so it was hard for me to leave UK. I always thought that they would have to push-pull carry me out of there. I've received all my degrees from UK, my nursing bachelor's degree, my public health master's degree, and my public health in nursing master's degree.
Wow.
So I'd been there for a long time. I grew up at UK, had a great career there, but I found this as another opportunity, just another way to spread my passion and spread my wings a little bit more. And so I decided to take the position. It's so funny, though, one of the past commissioners, Beth Mills, who probably a lot of your listeners know.
Yes.
Very beloved commissioner. She sat on the Board of Health as Commissioner of Social Service, always sits on the Board of Health as well. And I remember looking at her when I was a board member thinking, her job seems pretty cool. Never knowing that I would sit in her chair one day.
Right.
And so Commissioner Ford, Chris Ford, was the most recent commissioner of social services, and I'd gotten to know him again through the board. And when the mayor called me, the first person I called was Commissioner Ford. I was like, okay, what is this? What am I getting myself into? I came over here. He gave me a tour, sat me down, talked to me a little bit about all the social services. Again, many of the divisions and programs I had worked with previously through my work through UK and the Lexington-Fayette County Health Department. So I wasn't totally unfamiliar with what social services does. And so I took a leap, and I'm so very thankful that I did. It was the best step I've ever made in my career. Absolutely.
It's definitely great to have you. I mean, you've been really busy in your career, and it's just amazing to hear all the wonderful things that you've accomplished so far.
Yeah, so let's take a step back. Was there kind of a moment or a group of moments that really led you to this path of nursing and public health? What sort of really drew you to those professions, I guess?
So for nursing, I've wanted to be a nurse since I could talk. My family talks about how my grandmother, I was 2.5 going on 3, that she was walking down the stairs at our church and she fell. She was carrying me and she fell. And she was able to kind of push me to the side, so I didn't get hurt, but she kind of hurt her leg or whatever. So when we got her home, they said that I went into the bathroom, took some toilet paper, dipped it in the toilet, and wrapped her leg in it. I mean, I was a toddler. Yeah. Totally gross, right? I would never do that now, since I'm a total germaphobe. Nursing school makes you a germaphobe. But from then, I've wanted to be a nurse. But with public health, I've wanted to be a public health nurse specifically. I was a missionary nurse in Kenya for an entire summer. And what we did was public health nursing. It's like the epitome of it. We went around the countryside of Kenya, mostly northwest of Nairobi, but in other areas as well, and did like immunizations. We did maternal child checks. I was able to deliver a couple of babies while I was there, because in Kenya it's the nurses who are in charge of delivery and not the doctors per se, and that just really solidified my vision of really preventing disease before it starts. And so being able to do that versus inpatient and being more focused on curative, I mean, I found my passion definitely during that experience. And so when I came back to America, I was determined just to work in public health. Now, I have worked in a hospital before, just to get those skills, just to really hone in on being able to start IVs, because lots of times as a public health nurse, you're out there in the community by yourself. So you need to have sharp skills for sure. But I did the minimum time in the hospital that I could to sharpen my skills, and then I left to work in more community-focused areas.
That's amazing. What's a lesson you took away from that trip to Kenya that you brought back to America? Sure.
To be very thankful for all the advances that we have, for sure. I remember experience that we did some, so our home base was this place called Tenbrook Hospital, which is northwest, again, of Nairobi, Kenya, and we would spend a couple of days there, then we would go back out to the countryside and do our thing. But while we were a couple of days at Tenbrook, there was a baby that was born premature, and he couldn't breathe on his own. And so we had an ambu bag, which is a bag that you use to give people air. And I was pumping that on this baby, and newborn, premature, and there was nothing else you could do. And I knew that if I stopped pumping this ambu bag, this baby would not get any air. And the doctor was, he was American. He was also there on a mission. And he was basically saying, you know, if we were in the States, this child, we would have him in an incubator right now. We would have him on a ventilator. You know, there's so many things. He would live if we were in the United States, but we're not. We're here in Kenya. And as long as I was pumping this ambu bag, he was getting air. But as soon as I stopped, I knew he would die. And I mean, eventually I had to stop, and the baby succumbed to death. And so the lesson that I brought back from that experience is, one, to be very grateful for everything you have, to seize the day for what you have, seize the day, do what you need to do, and just keep persevering in whatever your task is.
Wow. Man, I can't imagine that. But you definitely been a blessing to our community. We've seen you in the community do a lot of things and show up to a lot of things. We'll see you at a parade or whatever with your sorority and stuff like that.
Absolutely.
So the work that you're doing now in community service. So let's talk about 3 to 5 years. What's a goal? What do you see for the community and the work that you're doing, and how are you going to shape that?
Sure. So one of the goals that I had even coming into this role was one to bring that holistic aspect of nursing, because we look at everything. But if you remember in 2021, we were coming out of the high point of our pandemic, our COVID pandemic. And the pandemic, everyone suffered from it. But particularly in our world, in social service world, it was our nonprofits, our nonprofit agencies who, let me tell you, there's about 100 people in my department, 326,000 or so citizens in Lexington-Fayette County. We could not do our jobs without the nonprofit. And I said this from day one, and I will continue to say this, is that leveraging our nonprofits so they can do their jobs as well. Helping our nonprofits and the vulnerable populations that they serve, and we all serve together. We're all in this together. There is no competition. We all serve together, is helping them build their capacity, helping them just get over the devastating effects of COVID. We're still seeing things. There's federal changes that are causing nonprofits as well to have some problems being able to do the services that they need. And so I will continue, I've said this since day one, and I will continue that until I walk out of this office, is to help build the capacity of our nonprofit so that they can serve the populations and serve them together. And so that's the main goal. And part of that sub goal of that was to partner with our community partners and our nonprofits. So we can, one, to know what the left hand and the right hand's doing, right? But we can have a more collaborative effort to focus on the populations that we serve.
Okay. I've had the pleasure of coming through social service myself and seeing the commissioners that you mentioned. Beth Mills, I started with her in the beginning, and then Chris Ford, and now we have you. We have Commissioner Kacy Allen-Bryant. And people will probably be saying the same thing about you years to come. So what are you most grateful for? And is there anybody you want to give your flowers to? Because we're giving your flowers today, but what are you most grateful for, or who are you grateful for?
Well, first of all, I am grateful for this platform. Mm-hmm. I respect this position. I respect where it puts me. I'm able to be an advocate. I am able to affect change in our community, and not many people are in a position to do that, and I honor that. And I pray to make good decisions. You know, I pray to God always, what decision can I make today that's going to be most impactful and beneficial to the people that we serve? And I always think about the people that we serve. And I'm just so grateful for everything in my life. I'm grateful for my parents. My father was a retired police officer from Lexington-Fayette County, and he had a legacy, and I try to build upon that legacy. And one of the things he did is he wasn't going to just straight up arrest someone. He tried to work with those that he encountered, and again, he was focused on those really vulnerable people who are at risk, and how can he help them? And it's a different way, right? I'm not in law enforcement, but I'm still just trying to help people who, I was blessed. I had that police officer. My mom worked at a bank, had a very stable family life. We had things that I don't ever take for granted. We had food on the table. We had a house. We had cars. Not everyone has that. I mean, I try to pass that on to my kids too. I'm like, yes, I know you guys are super spoiled, but let me tell you, there are people who don't know where their meals are going to come from. Like, be grateful for that. So I am so grateful for my family for keeping me very grounded, because I could have been a very different person based off of potentially based off my background. And so I'm just great. I can't say it anymore. I'm grateful for the fact that I have a home. I'm grateful that I don't have to worry about where my food's coming from. And I realize that not everybody is in that same position. I'm grateful for my children, that they aren't involved in things that they're not supposed to be involved in, because it could be very, as you know, Gio, it could be very different. They could make very different choices. So I'm grateful for my family. I'm very grateful, well, my parents specifically. I'm also very grateful for my aunts. My dad's sisters were and continue to be very involved in their communities. Our family is based out of Paris. One of my aunts, in fact, has been a commissioner there in Paris. It's a very different role, but she was a commissioner, so we always laugh. That's a career that runs in the family, being commissioners. I have another aunt who was serving meals to the homeless at her church. So I've always had aunts that are really focused on their communities, and they kind of passed that on to me. You know, they would pull me into meetings and things when I was little, and I just saw that ingrained in me, right? So my motto, and I say this, is God, family, community, and I get those values from my parents and my family.
Nice, really nice.
So let's talk a little bit about the community and what health and healing look like in our community right now. So what are you seeing, or what are you noticing that's helping families feel, stronger, healthier, and more connected? Sort of what's working, what's giving you hope?
So I thought a lot about this question, and I'll try to keep this very condensed because I could probably go on about this forever. I feel like in many ways our community has come together. There have been various incidences in the last 4 years that I've been as commissioner that I feel like our community has rallied around. Unfortunately, we've had some issues with gun violence, and I think our community, though, has rallied around preventing gun violence. I hate that people have died. I hate that people have been victims, but it has brought certain aspects of our community together. So I'm hopeful that when Lexington has something horrible happen, that we can set aside our differences and come together for that. We're doing it for gun violence. We did it during COVID, so that was like, people can rally behind each other and support each other. I mean, during COVID, I don't know how much you all necessarily in your backgrounds had to work with any organizations or whatnot dealing with COVID, but when COVID first started, I was chair of the health department, the Board of Health, and so I was heavily involved with the COVID response. And just when it came to anything from simple as folks donating food, it was people were coming out of their pockets, food that they probably couldn't even spare themselves, to help other families, because what was happening was the unemployment was so, if you guys remember, the unemployment was so high because of COVID. Nobody was working because things were shut down. And so those are the kind of things, just the fact that we as a small community, we're small but not small, right? But when bad things happen, I do have a strong belief that we will rally together and help.
Amazing. Again, y'all, we got Commissioner Kacy Allen-Bryant. So as we start to wrap this up, there's going to be a lot of people listening to this podcast, a lot of viewers. What is a message that you would leave our listeners and viewers, and especially our young future champions and our younger generation?
Right. Don't ever give up hope. Change is possible. Even little contributions help. And everybody has something to bring to the table. I actually had a meeting last night, and we were talking about advocacy and how your personality and your talents, how can they contribute to advocacy? And so, there were a couple of people on the call who were saying, well, I don't really like talking to people. Well, that is that's a necessary thing if you want to advocate among, legislators. But then what I said to one of the gentlemen was, but you're a great writer. You're perfect for writing op-eds or for writing grants or what have you. So my point is that everybody has a talent, that they can bring to the table. Whether they think it's a good contribution or not, don't be afraid to bring yourself. Don't be afraid to be present and to help make that change. And rally together. I can't say that enough. We are so much more powerful if we come together versus one person doing it.
Well, that's amazing. Let's throw a couple of fun questions in here. So
Sure.
we bond over music. What's a song or artist that you turn on when you need a reset? So when you need a pick me up or maybe a calm down?
Okay, so I have my kids don't know what they're going to get when they get in my car, because they're either going to get gospel, which, you know, I was raised in a very religious household. I've listened to gospel all my life. I enjoy gospel. It lifts me up. It definitely calms me down. Whichever mood that I'm in, it helps me get to a better mood if I'm in a bad one, right? Or if I'm trying to get hype, it keeps me hype. Just depending on, you can listen to some slow gospel songs, or you can listen to some sad, you know, wade in the water gospel songs. So that's mostly what I listen to. But I also go back to the late 90s, early 2000s sometimes if I have to really, you know, get hyped up. So I'm not even going to name all the artists because I don't want y'all to know how ratchet I can be. But, you know, we were all young once.
Of course. Definitely.
So since the podcast is called IChampionHealth Chats, we ask each guest to fill in the blank. IChampionHealth through or IChampionHealth by, what would you say?
So I thought about this. I would definitely say 2 words. I champion health through advocacy and education.
Amazing. Last word, give a quick plug for social services.
So in social services, our department, we have 3 divisions and multiple programs. And what we're trying to do is to help everyone from infants to seniors. And we help them through giving them multiple services, such as everything as simple as perhaps clothing, to childcare, to socialization services. And so we're trying to fulfill that gap in some of the human services in Lexington-Fayette County. Again, I say we could not do it without our nonprofits. We also bring attention to major issues that are affecting our communities, such as substance use disorder, opioid overdoses. You may have seen in the news have reduced quite a bit over the last year, and that's due to efforts of our substance use disorder intervention program, along with our partners like Lexington-Fayette County Health Department, Voices of Hope. You know, there's other partners in town that are also working together collaboratively. Again, collaboration. Community partners, you know, that's key. We also highlight issues like domestic violence. We have someone on staff who coordinates a coalition that brings together all of our domestic violence partners in town. Again, collaboration of organizations. But we also have programs that empower our youth. We have a whole Partners for Youth program that you may have heard of and may have been to some of their functions. They again are on the part of promoting youth and doing positive activities for youth to be involved in and to uplift those partners in our community. But we have our youth services, which I think Gio may work with some of them, who work with our court-involved youth, and so the needs of those youth and their families. We have our family services, which works with our early childhood care, our families, are those with young infants, our HANDS program that will help them with developmental milestones and to teach them and educate them. So we have a variety of programs for everyone, really. Literally from the cradle to the rocking chair is our motto.
Nice. All right, ladies and gentlemen, again, we want to thank you for tuning in to another episode of IChampionHealth Chats. Again, I'm your host, Gerald Gio Gibson, and our special guest today was Commissioner Kacy Allen-Bryant. Our co-host today is Mr. Jacob Hester. Again, we appreciate you for tuning in. If you want to get involved, please get involved with your community, and God bless. Thanks for tuning in to IChampionHealth Chats. If something you heard in this episode spoke to you, don't forget to follow us and share it with your community. You can find us on social media at IChampionHealth or email us at ichampionhealth@uky.edu. This season was paid for with funds from the Kentucky Opioid Abatement Advisory Commission by and through the Office of the Attorney General. The opinions and recommendations expressed in this podcast are those of IChampionHealth and the guests. They do not necessarily reflect the views of the Kentucky Opioid Abatement Advisory Commission or the Office of the Attorney General.